Thank you so much, Toby, and thank you also to Professor Jeremy Pitt and co-organisers for the opportunity to present in today's workshop. I'm delighted to be here with my fellow panelists, and in this statement, I'll be looking to establish the case for co-designing location-based services for individuals living with dementia and the dementia community, whilst also highlighting select implications and challenges that are relevant to the theme of today's workshop. These challenges really stem from the use of location-based services and related technological solutions, including artificial intelligence. But before I do that, I'm joining you this evening from Wollongong, Australia. And as such, I'd like to begin by acknowledging the traditional custodians of Dharawal country and pay my respects to the elders past and present. In terms of the research that I will be presenting today, I'll be providing a background into location-based services for individuals living with dementia, followed by an overview of two modes of operation. And this will lead us to a discussion of implications and a proposed human-centric path forward. In doing so, I'd also like to acknowledge collaborators of over 16 years of this work, Professors Katina Michael and Associate Professor M.G. Michael. Additionally, I'd like to also express my gratitude to Professors Melanie Randall and Lynn Phillipson from the University of Wollongong, who have more recently supported the developments in this research and its conceptualization. By way of introduction, dementia is an encompassing term that's used to define a series of neurological conditions which are characterized by a decline in brain function. It's reported that every 3 seconds, one person worldwide will develop dementia, and currently there are 55 million individuals living with dementia globally. It's estimated that by 2050, that this number will considerably increase to 139 million. A recent dementia action report released by Dementia Australia expressed that despite increased appreciation of the fundamental rights of individuals living with dementia, discrimination and lack of inclusivity in society were still experienced, which is pertinent to today's discussion around future artificial intelligence-enabled solutions that may, unless carefully designed, exacerbate these issues. Dementia is recognised by the World Health Organization as a public health priority that typically results in individuals being stripped from their basic right to freedom and to choice. As this disease results in the progressive deterioration over time, individuals living with dementia might find themselves in vulnerable situations. For instance, an individual might be unable to return home or feel disoriented in unfamiliar contexts, lacking that cognitive ability to retrace their movements. This is often referred to as wandering, which is a term that's quite contentious in its own right. Reasons for this disorientation or this wandering include changes to the environment, the need to use surplus energy, for instance, searching for the past, so for people, for places. And one interesting one as well is following their dreams, given the difficulty to distinguish between reality and dreaming. And there are many more reasons. As such, a common challenge for the dementia community is the safety and well-being in such circumstances. Studies in the location-based services and associated emerging technology space often investigate the use of technological devices and solutions that can benefit the dementia community when faced with this common challenge, particularly given the life-saving potential that's facilitated by location monitoring and tracking capabilities. So whilst the literature in the location-based services domain points to the associated ethical implications, so implications such as, or issues such as privacy and consent, in addition to regulatory considerations, we need to look beyond these existing studies in designing location-based solutions for the dementia community. And as part of this statement, it's helpful to consider two modes of operation in exploring these ethical implications. They are the present mode of operation and the future mode of operation, which is where artificial intelligence predominantly comes into play. For over a decade and a half, we've conducted research into the social implications of emerging technologies and socio-technical consultative processes. With respect to location-based services, our consultations have focused on what is now considered a present mode of operation, and we're currently investigating how these processes look and are shaped by opportunities and challenges presented by the future modes. And I'll briefly provide some information about those modes. So in the present mode of operation, we're referring to commercial location-based services that allow for the tracking and monitoring of individuals using wearable or luggable or portable devices that can be adopted potentially by the dementia community. These devices are usually marketed and sold as individual units to be purchased and utilized in a voluntary capacity by often inexperienced carers or caregivers and end users. And this is done in order to maintain the safety of a loved one. And there are many such examples of the commercial solutions of which I'm referring to. A reported concern here, and something that has definitely emerged as part of our research, is that these solutions are generic in nature and not necessarily sensitive to the needs of individuals living with dementia, nor their carers. Considerations such as user requirements and lived experience are rarely taken into account. Furthermore, caregivers are responsible for the selection, the adoption, and the implementation of these devices and solutions. Now, when we move on to the second mode, which is a future mode of operation that's been proposed, whereby artificial intelligence or intelligent or AI-enabled location solutions would utilize machine learning algorithms, this becomes quite problematic. With the use of AI and corresponding training data sets, multimodal data sets, you're able to achieve a range of outcomes relating to the safety of an individual living with dementia. So these systems and solutions would allow for a preemptive capability or preemptive capabilities. And this could involve, for instance, the early diagnosis or detection of cognitive impairment or decline by studying movement patterns of individuals, and then using artificial intelligence to detect cues and early warning signs of disorientation using perhaps biometric data. The individuals considered at risk in diverse use case scenarios will then automatically trigger an appropriate response if they are or were pre-registered on either a publicly administered platform or a privately owned one. The integration of biometric data, such as an individual's location chronicle, their facial characteristics and gait, results in a transition from the traditional personalization-based location applications that depend on a token carried by the individual living with dementia to those that additionally offer increased accuracy of information and service provisioning. They also offer enhanced recommendations and predictive analytics capabilities embedded within the environment. This would theoretically provide the ability to introduce personalized care, implement appropriate intervention strategies, and ensure prolonged independence of individuals living with dementia and their carers. But the question I pose here is, at what cost? So while there are clear opportunities with present and future modes of operation, technology, specifically AI-driven location solutions, may exacerbate the marginalization of individuals living with dementia and/or those exhibiting patterns of behavior that are aligned with this neurocognitive condition. And this talk points to this talks to the point I made earlier about issues of discrimination and exclusion from society that are experienced by individuals living with dementia. Identifying what would be considered at-risk individuals can be desirable from the perspective of preventive and proactive approaches to care and safety, but this also provides opportunities for exploitation, including surveillance, prohibiting access to certain services, and compromising the autonomy and the dignity of individuals. Relevant to this workshop and emerging from these scenarios is an evident power asymmetry between individuals living with dementia and the carers, and the entities or stakeholders who will be in command of the location-based systems and platforms, notably those who are responsible for the collection, storage, dissemination, and use of location and other contextual information in the present modes of operation, to those individuals and entities or stakeholders designing the machine learning algorithms in the future modes. Socio-technical issues concerning privacy, data ownership, control, and much more must be considered in the context of both modes of operation. So where to in terms of proposed solution? With respect to a proposed path forward, we contend that regardless of the mode of operation, technology alone is insufficient to facilitate the safety and the freedom of individuals living with dementia. Rather, the emphasis of any proposed platform must be on care. We propose that socio-technical co-design or the socio-technical co-design of a care platform oriented towards facilitating safety and freedom using location-based services and other appropriate technologies is the desired path forward. The co-design element is key here. So in addition to including the individual living with dementia, other stakeholders such as carers or family members, health and medical professionals, law enforcement agencies, technology providers, government agencies, academic institutions, peak bodies, and more need to be included to varying degrees in the design of these systems. The proposed human-centric approach will support and allow for the integration of the requirements and values of individuals living with dementia and the identified ethical and other challenges in the underlying design of the proposed system, whilst also supporting the needs of others in the dementia community. Our fundamental idea is to look to and collaborate with dementia researchers in the community to define participatory approaches that would suitably determine the nature of engagement and the nature of collaboration that's required. Significantly, the selected co-design methodologies must be empathetic in their design and aid in desirably influencing and restoring the self-esteem, dignity, identity, and feelings of community connectedness of individuals living with dementia. The application of socio-technical co-design in the dementia and health context signals an important change from the dominant technological focus in industry or of industry to the socio-technical focus or lens, at the heart of which is care. The ideal scenario here is the simultaneous provision of safety and freedom through community empowerment in the design of current and future socio-technical solutions. However, the success of the proposed socio-technical co-design approach is heavily reliant on our willingness to capture lived experience and to listen, rather than blindly adopting technological solutions because they are available. An alternate approach is to attempt to balance lived experience and professional expertise in systems design. Thank you.